respect to the pandemic that has really hit the regional economy, I'll ask you two questions, and then we'll follow with Governor Hogan and then you, Mayor Bowser. What's the one thing you think that was of critical importance in getting to where we are in each of your states and in the region? And then following on that, what do you think the business community can be doing now that we seem to be balancing out here a little bit? What can the business community be doing to help you all continue the effort to kill this thing till we can get to a vaccine?
Well, Tony, we're in a much better place today than we were 6 months ago, but I think the mayor and the governor would agree. We've been fighting a biological war, and we started fighting it without adequate supplies. And being an Army veteran, that's not a good way to go into battle. And so we've really worked hard to get the amount of PPE, to get that supply stockpiled. And I know Maryland and Washington have done that as well. And so we're in a much better place there. You know, testing, Tony, is so important. If you think back when this started, we just had a few tests that we could do each day. We were sending them to the CDC in Atlanta. The turnaround time was anywhere from a week to 2 weeks, and certainly that was unacceptable. And now in Virginia, we're testing 15,000 to 20,000 individuals a day. We're anxiously awaiting the antigen test, where we can get a much quicker turnaround time. That's so important for taking care of individuals, and we've actually teamed up with Washington and Maryland to be able to do that when the supplies are available. So, you know, the governors and the mayors, as I said earlier, have really had to step up. We've worked together. We've taken the partisanship out of this and really compared notes and done what was in the best interest of our constituents. And so to sum that up, Tony, we're in a much better place today than we were 6 months ago, but we still have a lot of work to do. And to your point, and I certainly say this as a physician, this virus is extremely contagious. It is unpredictable, and we need to maintain our vigilance, all of us, and wear a mask, keep our social distancing, wash our hands, do the things that we know work. As far as what the business community can do, and this was said earlier as well, some businesses, Tony, are doing better than others. I mean, the hospitality industry, restaurants, transportation, these industries have been hit tremendously hard. And so we need to do everything that we can to help them get through this, to help them keep their employees so that they'll be able to maintain their business and then come out of this strongly. And from a business perspective, it is really important right now that we focus on training and retraining our constituents, especially those that are unemployed. So I think we need to really focus on our education system. One of the reasons that Maryland, Washington, and Virginia are doing as well as we are from a business perspective is because we have a very talented workforce, and we need to remember that and keep that moving forward. So it's important that we continue to support our colleges and universities. We have 23 great community colleges in Virginia, and just focus on what the jobs are out there and how we can be as nimble as we can be to train individuals for that particular workforce.
Thank you. Governor Hogan, can you speak to the one thing that you thought was the most effective for you in your approach? And then what can the business community be doing to help going forward?
Sure. Well, first of all, I would second everything that Governor Northam just said, and I don't want to repeat all of those things, but he's absolutely right. And I would say the one thing that we were really weak on in the country early on in the pandemic was testing. And we have improved dramatically, but I think that's the number one thing that's going to continue to be an issue. It's testing and eventually getting to a vaccine so we can actually try to get back to some sense of normalcy. But on testing, we've made dramatic improvements. As the governor said a moment ago, at the beginning, we were the states, and I'm sure the district and the territories were scrambling and fighting in a very constrained worldwide market to try to get desperately needed supplies that were not available. And we've improved in a lot of that with respect to PPE and testing. We've done a better job on contact tracing. The early versions of the test were not as sensitive and not as quick, and the labs were overloaded, as Governor Northam said, and it was taking too long. And but we've made dramatic improvements. That's going to be the key to getting our economy and our businesses back. And we'll get a vaccine and do rapid testing. So there's new rapid point of care antigen testing, which a couple of companies were just approved with emergency use authorizations by the FDA. Governor Northam and I, these groups came to me as chairman of the National Governors Association, together with the Rockefeller Foundation. The federal government was not really at that time moving forward with these rapid antigen tests, and they asked if we could try to get some states together to do a compact. And Governor Northam joined with me, along with 8 other governors of various states, 5 Republicans and 5 Democrats, and we put together a compact to acquire 5 million of these rapid antigen tests, which is going to make a real difference. You can get a result in 15 minutes on site with a little device that's not much bigger than a cell phone. And you take this sample and you put it right in there, no waiting for labs. I think that's going to be a dramatic game changer. We had an announcement last week. One of these companies has 2,500 employees in Maryland, in Sparks up in Baltimore County, and we had an announcement with them and the Rockefeller Foundation. Becton Dickinson is the name of the firm. And we acquired signed a contract for our first 250,000 of these tests, but 10 states are going to get 500,000 each. And that's the start of what we hope to be, at some point, 100 million or more of these tests across the country, which would make a difference. We're also making really great progress on vaccines. We have 40 different companies and universities in the state of Maryland that are working and making real progress on the potential for a vaccine, which we hope maybe by after the first of the year, we'll have some vaccines to the point where we realize they work, but it'll probably be, quite a while until we get full production where we can get that out. That's gonna get us back to normal. The business community can really help, and they have been helpful. From the beginning of this, I put together a coronavirus recovery team. So we not only were listening to the smart scientists and public health officials and doctors, but we also brought in CEOs and business owners from multiple different sectors. And we listened to all their advice, and our Department of Commerce put together 13 different work groups by industry, and brought in even a larger group of people, of several hundred businesses that came in and worked together with us collaboratively about putting together safe reopening plans. And they worked together with our health department and with all of our state government teams that were working on this. We worked together with the private sector, and I think it is going to take all of us working together, everybody at the federal, state, and local level in government, but also the private sector has the innovation, and the private sector knows how they've come up with great ideas that none of us ever thought of about how they could return to work and get more people working either remotely or getting some people back into whatever facilities. Lastly, and I'm turning it back over to you, the governor mentioned the hospitality industry. They really are hurting, and restaurants in particular. And we're doing a thing after this today about Restaurant Week in Maryland. So any of those businesses that are listening that are in Maryland, please try to go out and support those restaurants, whether it's delivery or carry out or sitting outside or dining in, whatever. They really need our help right now.
Mayor, I want to give you an opportunity to talk to that question. What do you think the one thing was that was most helpful to you as you tackled the height of the pandemic, and again in your jurisdiction and in the region, what do you think the business community can be doing to help going forward?
Well, let me start with the business community, and I think there are 2 really big things that you can help with. We still need state and local help from the national government that hasn't been fully addressed. And I see Governor Hogan nodding because he's been at the forefront of advocating for state and local governments. The CARES Act was a big help and it was a great start. But we need the national government to step up. I've said from the beginning that the hole created in our economies for COVID is larger than any local government can fill. And so these hard hit industries, the president likes to say, people are in some of these tough economic times through no fault of their own. And that's the same for state and local government. So we need the national government to be strategic, but to also make sure that our first responders aren't affected by this at the end of the day, and that our teachers and great municipal workers and all the things that we do as a local government that can't and shouldn't be done by the federal government aren't disrupted by COVID. So I continue to press on our business community. When you're making these asks, we want you to be fully armed with the information that we have, so that our state and local governments and what we have been able to do in our economies aren't disrupted. I will build on what Governor Hogan just mentioned, and that I think that the business community can be our great partners in workforce readiness and confidence, because all of the things that we're doing for safe reopenings won't be impactful if people don't feel safe coming into their offices, using public transportation, or going to our mom and pop shops and restaurants that have all suffered through this pandemic. So as an example, we have safe work return policies for our own workers. And I think that you're going to see slowly that we will be rolling those things out, so that your offices, I know you're in downtown Washington, and we want your colleagues to know, and your building owner to know, and your firm to know what are the safe practices to bring your workers back downtown safely and incrementally. Those are the two big things that I would mention. And as for the one thing that has worked, let me just say that I have been blown away by the sacrifice and level of engagement of DC residents and businesses. And I would say a key takeaway for me for this, and I'm sure my colleagues agree, is communicating often and candidly with your residents, because they're smart, they want to follow the science, they want to do what's best for their families and for their communities. And when you give them that information frequently and candidly, they will respond, and they're going to be there for the tough decisions, and they're going to be there with everything we ask them to do to bring our region back.